Hi there, we're back. I'm Jennifer Lewis Hall, and you're watching BETJ's My Two Cents. We're talking about mental health, and joining us for this panel are, of course, my co-hosts Breon Bain and Keith Boykin, and our guests. We have Salai Abrams, who is the author of No More Drama, and Dr. Carl C. Bell. Welcome, everyone.
Thank you.
This time around, and I want to know this because we were saying this is a good question. Poor mental health versus stable mental health, good mental health. What does that look like? I mean, Salai, there's so much that we're learning about in your book. You dealt with suicide and alcoholism and a lot of things in your life. But I want to begin with you, doctor. What does it look like to have good mental health? Because I think sometimes people equate, someone homeless on the street or someone who's down and out, talking to themselves, ranting, raving. There's a lot more to know. What can you tell us in a microcosm?
Well, when I started out being a hardcore psychiatrist, I was very concerned about mental illness. And then as I've gotten older and older and older and older and older, it's now clear to me that rather than focusing on those risk factors,
yes,
I need to be focusing on the things that strengthen and protect people.
Okay.
Because the research is very, very clear. A lot of people have a lot of problems, a lot of problems, but they don't succumb. The drive home statistic that I like to give is 20,000 out of 100,000 people get depressed. 8,000 out of 100,000 attempt suicide, but only 20 out of 100,000 kill themselves. So there's got to be something protecting all those people who don't commit suicide. And psychiatry has done something very, very stupid. We have focused on the deficit illness model.
What does that mean to the layperson? I don't know the definition.
People who are mentally ill. We focused on the suicide completions.
Okay.
Instead of focusing on what kept.
I mean, I would like to know myself, how do you know if there are some glaring warning signs that you should be looking at when you say, you know what, either I'm drinking too much or this is not normal behavior?
Anytime your social, occupational, and anytime you're not functioning well, you're in trouble.
Okay.
And I would like to interject that even when you're functioning well, that's really open to interpretation, because when I was going through a lot of issues in my life, I looked like I had it all together. I looked exactly like I did now, except what was going on, that dialogue in my head was completely off. And so in my case, when I attempted suicide at the age of 24, I was modeling. I had a child. By all intents and purposes, everything looked fine, but I was also a functional alcoholic. And when I was given psychotropic medication by a primary care physician who judged me based upon my appearance. And then when I was sexually assaulted one night after drinking, Prozac and drinking don't mix.
No, they don't.
And next thing you know, I'm in a psych ward for 5 days. So I think for me, when I define mental health, like M. Scott Peck said, the dedication to reality, it's an ongoing dedication to reality at all costs. So for me as a recovering addict and all the other issues I've gone through, I have to be very cautious about, am I slipping into fantasy-driven mindset?
Right.
What is this fantasy-driven mindset you're talking about? I mean, because how do you know if you're slipping into it or not slipping into it in the first place?
Well, when I say fantasy, I don't mean, woo-woo out there kind of fantasy. I'm talking about what I want is more important than what is. So for me, being strong-willed, I'm going to will something to happen. All the signs are there that this isn't working out, but I'm going to keep going. And there comes a point where that becomes a problem.
A lot of people say it's just tenacity of determination. Some of the New Age thinkers will tell you, if you will it, it will be. Should we not do that? Is that what you're saying?
Well, you got to look at what are your outcomes. For instance, with me being in a relationship where all the signs are there that this person is being unfaithful. Right? But because I want to get married, I want to move to New Rochelle, I want to live in a big house, he's the guy that's going to help make this happen, and I ignore all those signs and then end up completely depressing. How did this happen? Why am I so upset? Why is my life a wreck?
And see, I hate to say this again, but this is to me exactly why I don't think we can look outside of ourselves to find our happiness. We have to take care of ourselves. And in order to do that, we have to look in and find out who we are, do some deep thinking about that, and then we can have relationships with other people. We can, because we know who we are first.
But I think it's so hard, though, especially for people in our communities, in the Black community, because I think we're expected to be so strong and to deal with so much. And while you're talking about things that many women can also relate to in terms of, is this the guy? Is he Mr. Right? And then falling into depression over it. I wonder, though, is it doubly hard for us because we have so many different things we're dealing with? Economic despair in some of our communities. Relationship breakdown of the family. I mean, you know, the list could go on.
I am not going to be a passive, helpless punk. I fight.
Right.
I like to fight because that gives me, it's mastery.
Right.
It's empowerment. It's something that we call self-efficacy. If you've got a sense of, I'm going to fight this, whether I win or not, all of these horrible things that happen to people, don't break them or destroy them. Perfect example right here. Perfect example right here. I talked to a woman who got raped, and I was apologizing for our manhood. You know, I'm sorry for men that did this to you because they're stupid, obviously. And she said to me, that did not define who I am.
Right.
Right. And I totally, what you're saying resonates with me in terms of focusing on protective factors rather than risk factors. I'm also thinking about, like, somebody I love, one of my boys, Nana Williams, who's been locked up since he was 17 on death row in Texas for a crime he didn't commit. And now, finally, he's 33 this year. All this evidence is coming out that he didn't commit the crime. The police department in Houston actually, you know, played with the records, and like it's happened so many times. And for him being locked up for throughout his 20s, most of his you know, his reproductive years, you know, it's hard to not focus on his particular situation. He's a fighter and he's fighting.
But how much can you fight? I mean, and how much can you
there.
fight? And realistically, I think that's even a question. And I'm interested to know, when does helplessness then actually weigh on your mental health? Because if it's not what you said before, helplessness certainly probably could get you there. But we'll find out. We'll be right back. Stay tuned. You're watching My Two Cents.
Males have entitlement dysfunction.